Good afternoon, this is Joanne, and this is my phase 1 video for D158, strategically planning the execution of a healthcare improvement project. So this video will talk about the results of my force field analysis in collaboration with the interpersonal members of the project team. This force field analysis consists of 3 positive and negative forces that will drive or restrain the proposed implementation of the HIP. My project is about reduction of preventable hospital readmissions 30 days post-discharge. So while I worked on this project, I realized that the force field analysis is used by many businesses, not only in healthcare, to assess feasibility of a project. The stakeholders in this project were motivated to push through with this project despite the restraining forces that were identified. And weighing both sides of the force field analysis, the team recognized that the driving forces outweigh the opposite forces. So the 3 positive or driving forces that I have identified are, of course, the increased reimbursement by CMS. We all know that CMS reimburses facilities based on the quality of care rendered by that facility after a patient is discharged, and physicians are paid based on the quality of their services, not the quantity of their services. The second positive force we identified is, of course, improved patient outcomes, not only because of health issues, but also financial issues. It is going to be less expenditure and unexpected expenses for the patients to not be readmitted to the hospital within 30 days. And also it serves as a quality indicator for the facility. Value-based care is one of the opportunities being looked at, which will greatly impact the patients and the organization. Patients will incur less out-of-pocket fees for better outcomes, and the facility will improve care coordination and better cost control due to incentives and improved technologies. Another driving force is staff empowerment and involvement, and also the strong support of the leadership and administration. Now, the negative forces that we have identified is number 1, limited virtual and personal access to discharged patients. Virtual access, meaning for patients who are far-flung and who don't have any internet access, is kind of a challenge to be accessed or reached. Also, for those patients who are out of state, it will be a challenge to reconnect with them, and those who have changed addresses as well. And because of the pandemic, there is still some limitations in performing face-to-face or in-house patient visit. So that is one limitation identified. Another one is the funding of the project, and resources are limited because it's an unexpected expense and also costly resources. Another one is the staff buy-in in relation to short staffing issues and the resistance to change. The plan is to convert the restraining forces, or to address the restraining forces via education, and at the same time, although the team focused on the impact the forces will create, and based on the gathered effects, the project is still deemed viable. The limitations and barriers can be addressed and negotiated, albeit tasking in a lengthy process. The strengths and opportunities were re-evaluated or revisited and are still applicable to the HIP. And the strategies that are in place are still able to reduce and minimize barriers brought forth by this change. And utilization of the strengths to overcome the negative forces, or convert this into positive forces, are still strongly recognized. So that's it. Thank you for watching.